Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. I wish you and your families the best this holiday, whether you're celebrating Ramadan, Passover, or Easter, or just a much-needed long weekend. As you know, we're well into the sixth wave of the pandemic, driven by the more transmissible BA2 variant, waning immunity, and the lifting of pandemic control measures, including gathering limits and most recently the mask mandate. This wave, we have seen a dramatic increase in transmission in the community, which we're tracking with our wastewater signal. Fortunately, it appears that this increase seems to be slowing somewhat in York Region and across Ontario, and may have peaked, but this leveling off is still tentative and uncertain. Unfortunately, we know that hospitalizations are increasing, and recent Ontario Science Table modeling data predicts that the continued moderate increase in hospitalizations will go on for several more weeks, as well as high rates of COVID-related absenteeism in healthcare staff, meaning a continued impact on everyone's access to non-COVID healthcare. In York Region, our hospitals are reporting that admissions have very recently stabilized, and overall in Ontario, we are hopeful that this increase in hospitalizations will be smaller than the last Omicron wave, thanks to the third and fourth doses that so many York Region residents have received to protect themselves and their community. York Region residents are continuing to mask in most indoor settings. Thank you for making the right choice. Both York Region Public Health and Ontario's Chief Medical Officer of Health are strongly recommending the use of masks in all indoor public settings. This is especially important when you're faced with the three C's: crowds, confined spaces with poor ventilation, or close contact with others. Or certainly when you may be around those who are more vulnerable, like the elderly or the immunocompromised. I know many of us were gathering over this past weekend, and many will continue to do so as part of ongoing celebrations. Be sure not only to mask, but to refrain from gathering if you are ill, and use a rapid test available for free at many retail outlets to test yourself, ideally twice, 24 hours apart, to be sure that you don't have COVID and to self-isolate. As you may already know, symptoms of Omicron differ that somewhat from those of previous variants, and the rapid antigen tests are somewhat less reliable, hence the need for two tests 24 hours apart. We know how important it is for everyone's mental and social well-being to get together with family and friends, but please do your best to do so safely. The most important thing you can do now to contribute to your own well-being and to blunt this wave and its impact on the acute care system is to make sure you and your family are up to date on your COVID-19 vaccinations. Everyone over 12 should now have 3 doses. Children 5 to 11 should have 2 doses, and those over 60 can now get a 4th dose. Getting your booster protects you from hospitalization or severe illness by almost 90% over 3 months and over 80% for the next 4 to 6 months. Vaccination with a 3rd dose also makes it less likely that you'll transmit infections to others if you do get infected. So please get vaccinated to protect yourself and your loved ones. You can book an appointment at york.ca/COVID-19 vaccine or call Access York at 1-877-464-9675. You can also find a York Region clinic near you accepting walk-ins for anyone who still needs a 1st, 2nd, or 3rd dose. The Ontario Science Table also recently released further information about long COVID or post-COVID condition, which we now know is more common among the unvaccinated, with up to 10% of unvaccinated suffering from long COVID symptoms, such as 2 months or more of fatigue, mental fog, shortness of breath, and other symptoms. There are no treatments for long COVID, so your best protection is prevention. Those with children in schools in York Region will have received a letter jointly from our largest boards or from York Region Public Health to other boards and independent schools. This letter shared with parents that our local schools and school boards are experiencing a significant increase in student and staff absences recently over the past 2 weeks. For this reason, and in partnership with our school boards, York Region Public Health is strongly recommending that all students, staff members, and visitors wear a mask in school following the return on April 19th. Everyone should wear a well-fitted 3-layer mask or a medical mask in classrooms, common areas including hallways, and while using school transportation. Wearing a mask significantly reduces transmission and helps prevent the need for school closures due to staff shortages. Our main goal is to protect your child and others from contracting COVID-19 while keeping kids in school for learning. There are a few other highlights I'm eager to share with you. Earlier this year, Canada authorized a medication taken by mouth at home that those who are infected with COVID-19 can take to prevent severe illness, hospitalization, or death. This medication is called Paxlovid and is now available at clinical assessment centers and many pharmacies. Your family doctor may also be able to provide access to this medication. The province recently announced the expansion of eligibility for antiviral treatments like Paxlovid and for PCR testing. This eligibility now includes individuals 70 and older or 60 and older with fewer than 3 doses of vaccine, as well as those 18 and older with fewer than 3 doses and at least one risk factor, such as a chronic medical condition, as well as those who are immunocompromised. These individuals can now be tested and assessed for treatment, and through the provincial distribution system, thousands of pharmacies will carry almost 40,000 doses of Paxlovid in Ontario. Visit the COVID-19 provincial website or speak to your healthcare provider to learn more about Paxlovid and to see if you would benefit from treatment if you became symptomatic with COVID-19. This prescription-only medication is meant to treat mild to moderate cases of COVID-19 before they become severe. It is not a replacement for the vaccine. Between cresting wastewater levels, ongoing masking, increased access to testing and treatment, and warming weather, I'm optimistic about the future. Please be kind and respectful to others as you are out and about, and please carry a mask with you and mask often in indoor settings. If you haven't got your third or fourth dose of vaccine, please do so as soon as possible. Stay safe and be well.